yes, I think it's unique that we have almost 16 years of electronic health records for everyone, e-prescription data and all this. We should take more advantage of it, using of the data. And also 1/5 of the adult population has their genome information digitally there. So combining that, and whether it's developing new services or products, smoothing patient pathways, moving towards predictive, preventive, more personalized care, this is what in what our challenge lies. There are always daily hiccups in current service provision. So how do you do this primary thing, provide services now, but also develop to be better in the future? This is my challenge, and how to set the priorities. But in general, I agree that e-health has been developed more rapidly than elsewhere, but we are not using the full potential, since the hardest thing to build is trust. Trust towards digital identification, digital signatures, digital health records. And since we have it, we can use this to be even better. Yes, of course. We are used to treating digital as something more efficient than paper-based systems. Of course, we can achieve efficiency, but there are equity goals and other goals we can achieve using digital tools. Because the myths that go around is that, oh, digital, it's you lose human contact, or it requires digital skills from the patient. But with digital prescriptions, well, a patient used to go to the pharmacy with paper prescription and ID. Now he or she just needs an ID. No digital skills are needed from the patient. So there are a lot of myths that need to be discussed in order to move forward. I would point out two more. One is that digital data, it involves huge risks. Privacy, security, it's something we shouldn't do because we don't know where we're going. Of course, with everything digital, the risks are there. They are different from risks in the paper-based system, but there are a lot more we can win. So, and there are ways to mitigate the risks. So knowingly, we have to take the risks and use the ways to overcome them, but it shouldn't hold us back. And with digital service provision, we are waiting for something huge, some innovation, new tools. But honestly, the technology is already here. We just have to test and try how to make it work in the healthcare sector in a way that actually patients benefit. And the regulations, for example, in Estonia say that the first appointment should be physical, and then you can have virtual appointments. But it's based on something we assume from the patient, that they want the physical contact. This is patient-centeredness. But it has turned out, particularly with younger people, when they, for example, need mental care or mental health services, they prefer the first appointment to be virtual, to get to know, to see who the doctor is, or clinical psychiatrist or psychologist. And then they can move on to physical appointments. So if this is the way patients prefer to have contact with the health system, we should enable it. So we are discussing changing the regulations in order to allow, for example, in mental care, have a first contact in a virtual way. So we need to test and try and adjust to the patient preferences as well.